Good afternoon, Chairman Nelson, Ranking Member Collins, and distinguished members of the committee. I am Brian Martens, an Assistant Special Agent in charge from South Florida. I appreciate the opportunity to describe how our special agents are fighting Medicare fraud and protecting seniors and taxpayers. We are making a positive impact in Florida and across the nation. Criminal prosecutions and financial recoveries have increased, while payments for services in certain fraud schemes have decreased. And the OIG efforts, together with those of our law enforcement partners, have led to a record-setting return on investment, over $8 to 1. Despite our successes, South Florida continues to be a hotspot for healthcare fraud. Miami is ground zero. In Florida, fraud schemes evolve quickly and can be both viral and migratory in nature. We see fraud schemes moving from Medicare Part B to Medicare Part C. Prescription drug fraud now involves non-narcotic, high-cost drugs. Home health schemes are transitioning to unnecessary physical and occupational therapy services. Organized criminal enterprises steal money from Medicare by creating sham companies or complex networks. Healthcare fraud criminals are dangerous, and we often find weapons when we execute warrants. These criminals target the most vulnerable in our society, our seniors and the disabled. When Medicare fraud is committed, the health of beneficiaries can be compromised. Take, for example, an HIV-positive beneficiary who lived in a boarded-up mobile home in South Florida. A professional patient recruiter paid him to go to a clinic that billed Medicare for expensive treatments that the patient never received. That beneficiary willingly chose to accept cash kickbacks and receive low-cost vitamin infusions instead of the appropriate medical treatment. A local doctor complained to us that the patients at that clinic were using the cash kickbacks to buy drugs and alcohol, and those habits only made the patients more sick. Thankfully, the majority of cases don't involve direct physical harm to patients that we have in Florida, but beneficiaries can be harmed by the Medicare fraud in other ways. For example, when a patient's Medicare number is stolen and used to bill false claims, the patient's medical record can be permanently distorted. This may cause complications or delays in treatment. Also, if a Medicare number is compromised and the patient can't get a new number, the patient is susceptible to identity theft. In Florida, beneficiaries play a role in Medicare fraud in 3 ways. 1, they're unknowingly involved and are likely the victims of identity theft. 2, some are unwitting beneficiaries who may have received a medical service but did not realize that the provider improperly billed Medicare, usually for a more expensive service than the one they actually received. And 3, unfortunately, in some cases, beneficiaries choose to participate in the fraud. They sell their Medicare numbers in exchange for cash or other benefits. Beneficiaries can make around $1,500 in cash per month for participating in Medicare fraud. Healthcare providers and beneficiaries can serve as the front line of defense by refusing to participate in Medicare fraud and reporting any suspected fraud to us. And I would like to thank those that already do, such as you, ma'am. Senator Collins, Maine is not immune to these fraud schemes. I've spoken with my colleagues, and examples of their Medicare work include prescription drugs, medical identity theft, home health fraud, although most of the casework is in Medicaid. I started today by telling you about some of our progress, but it is also important to tell you that OIG's mission is challenged by our declining resources at a time when healthcare fraud is on the rise. Our Medicare fraud strike force teams are not operating at full strength due to funding shortfalls and hiring freezes. And in Florida, over the past 2 years, we have closed over half of our investigative complaints due to a lack of resources. Among other things, the additional funding in OIG's 2015 budget request could support additional boots on the ground in places like Florida and elsewhere across the country. We appreciate this committee's support. In conclusion, I'd like to thank our agents in Florida and throughout the country for their dedication and hard work. Thank you for the opportunity to testify, and I'm happy to answer any questions.